Good evening, everyone, and thank you for coming out to the third town hall meeting in Brooklyn, New York on foster care, the discourse of ACS from the perspective of the community and parents. My name is Sandra Collette, and I do apologize. We're starting just a little late, so thank you for being patient. Again, my name is Sandra Collette. I'm with the Child Welfare Organizing Project in East Harlem. We work with parents who have been affected by New York City Children's Services. We have been in existence for almost 20 years. We started in 1994 at a time when there was absolutely no voice in the child welfare system from parents or community. Today we do have voice, but we say nearly not enough voice, because if we had enough voice, we would not be here tonight. We are joining together with every single person that has been affected by New York City Children's Services. That's parents, that's grandparents who are kinship, that is foster parents and youth as well. We're calling you all out to come to the community, to inform your broader community, to inform your elected officials, your city council people about the fact that New York City Children's Services needs to be transformed, and it needs to be transformed from the perspective of families and community affected, as well as those not affected. We have an esteemed panel here tonight that's going to speak to you. But before I actually introduce the panel, I'm going to introduce Sylvia Hooper, and she's going to tell you where she's from.
Hi, good evening. So again, my name is Sylvia Hooper. I am the founder and assistant director of FPA Foundation, which is short for Fostering Progressive Advocacy. So we're a grassroots advocacy organization that has been in existence for over 8 years now. And we work in the Harlem area. We're located in Harlem, but we service all 5 boroughs, and we are going to be a national organization as well, because we have a lot of individuals from all over that call us, that contact us, whether it's youth, whether it's parents, families that have been affected by both ACS and foster care. And so the reason why we started our organization is because many families feel that they have no voice within the foster care system. They feel like they're being taken advantage of by the ACS system. Children are being placed into foster care and becoming homeless as a result of aging out. And so, you know, just for that simple fact, we really as a community have to gather together and do more to protect our young people, to protect them, to make sure that they're safe while they're in foster care, and to also ensure that once they age out that they're actually receiving the services that they need, such as employment, going on to college, and getting the housing that's really afforded to them. So as I said, we are an advocacy activist organization, so we make it our business to really shame and blame the foster care agencies, to protest all agencies that are really doing unjust things towards families and children. So we have no qualms about that. We have no qualms about not taking no for an answer. We really stand up and be the voice for the families. We do also hands-on advocacy, where we go into the court system, where we go into agencies and really make sure that families' voices are being heard. So we're really glad that you're here tonight to hear more about the stories about how people are being affected, because this really is a systematic problem. So we all need to get involved as a community. Thank you.
Thank you, Sylvia. So go ahead, yep. So so I think I heard you say, I'm sorry, Ms. Millman? Oh, yes, ma'am. We do have plenty, and we hope you take it and take it to the community as well. Okay, so please allow me to introduce you to the panel tonight. I want to say thank you to the Audrey Learning Center here, and I must go on record to say that, you know, I came in and I said, oh my gosh, you know, this is a learning center. This is where kids will come. This is where we need to be seeing these in all communities, right? So we're here today because I believe that if we had more of this, we'd probably be seeing a little less of children in foster care and a lack of early learning children. And you know, this is what we're calling for. We're saying that these are the things that we need to have, as opposed to foster care and removals and things like that, because we believe if we have these types of community centers and learning centers, that our children would gain the knowledge, the parents would gain the knowledge as well, and we wouldn't have a need for all of the removals that we do have. So without further ado, I have a panelist speaker, Dr. Peggy Regensburg. And Peggy is the Regional Director of New York City's Office of the Safe Sleep and Infant, go ahead.
Sudden Infant and Child Death Resource Center. Used to be known as the SIDS Counseling Program.
So to make it very short, yes. So Peggy is here with us tonight to talk about safe sleep, but as well, we know that if there is a fatality in the home, that the possibility that that child or the death of that child will cause ACS to come into your life, and the potential is that your other children would be removed, right? So if we can learn more about safe sleep, that's going to save the lives of many infants, and that's also going to keep other children from being at risk of being removed. So Peggy will give you more information about who she is and what she has to share. And then we have another parent here. We have Joyce McMillan. Joyce McMillan, affected by New York City Children's Services. She will share with you part of her story as a person affected through mental health, a person affected with children who had some behavioral issues, and yet her children are still in foster care. Again, that's why we're out here tonight, because we want to say that for everything that you will hear tonight, we know that there is a solution, and the solution is not to have children removed, separated from their families, or traumatized. And then we have Denise, and I'm not going to call your last name Denise, but I will say Denise's first name. But Denise is from NAMI, and I know Denise a long time, and Denise trained a lot of parents who came through the Parent Leadership Curriculum from Child Welfare Organizing Project. And the reason Denise actually trained us about mental health and behavior was because, one, a lot of the kids that come into the foster care system have some mental health issues. The families might have mental health issues, and the children come in because maybe the family is not aware of the mental health issues, or diagnoses have not been properly diagnosed, so you don't have the correct training in order to work with your child's behavior. So that's Denise from NAMI. And then we have Miss Joyce Millman. Miss Millman.
Sorry about that.
And I should say, please put your...
You're right. You're right about that. Sorry about that.
So we have activist Joyce McMillan, excuse me, and I have to keep saying, because I have a McMillan and a Millman, and I keep getting them confused. So Miss Joyce is an activist for a long time, 1990s, helping families fight the child welfare system. Joyce will talk about her experience in working to transform the child welfare system, as well as working with an organization called United Women of Color for Change. So you have an enormous amount of experience on this panel, and I'm sure this is going to be a lively discussion at the end after they present to you. And we are going to start with Peggy here. She's the first sitting here in the end, so Peggy, take it away.
Okay, thank you very much, Sandra, and
You're
thank
welcome.
you for inviting me. I'm Peggy Regensburg, and I'm the director of what used to be known as the SIDS Counseling Program in New York City, and is now known as the Sudden Infant and Child Death Resource Center. For the past 7 years, almost 8 years that I've been the director there, we've transformed the program from one where we mostly did bereavement counseling for folks that lost an infant to SIDS or to a sleep-related infant death, or for folks who really just wanted some counseling over a pregnancy loss and things like that, to a program where we are doing as much as we possibly can, at least in the case of sleep-related infant death, to prevent these things from happening. My take on it is it's much more beneficial to stop the problem than be counseling people behind it after it happens. So we started to do research back in 2008 on the infants that had died from a sleep-related death in the city. And so what I'm going to talk to you about tonight is the result of that research. Part of it is particularly about this area, about this zip code, about a lot of the other poverty-stricken neighborhoods in Brooklyn, but it's also about mostly in every single borough where these deaths occur, it is associated with the level of income, meaning that the lowest the level of income is, the more likely the deaths are to occur in that area. The Department of Health for years was content to just look at these things as a matter of race and a matter of failure on the parents' part to follow through with safe sleep guidelines. My research shows that the most important thing involved in these infant deaths is whether or not the parents have the resources to have a safe sleep environment for their children. Every single one of these deaths comes across my desk. Sometimes I meet the parents or parent that's involved. It is probably the most painful counseling session anybody in the profession can have, is with a parent right after they've lost their infant. And that really lit a fire inside of me to make this as accessible, this information possibly could, and also help folks to understand that I'm not here, and I say this every time I do the presentation, I am not here to tell you how to parent your children. You know how to parent your children. That's not my aim. My aim is to show you what we've learned about safety in only recent years. These are maybe the last 7, 8, maybe 9 years, mostly in New York City, that we have found what the most important things are that parents need to know about taking care of infants as far as their sleep situation is. When I say infants, I'm only talking about babies under 6 months old. Right? We used to talk about them up to a year old, maybe older than that, but we know now that developmentally, most of the time, the infants that we're talking about are out of the danger zone by the time they're 6 months old. When infants are able to turn themselves over and can lift their head up and maintain their head up for a period of time, and can turn their head from side to side deliberately, you know, not just by accident because it's bobbling around, that infant is no longer in danger of a sleep-related infant death, okay? So I'm not going to show you every single slide that I have on here. I'm going to show you some slides that are pertinent to what I'm talking about. The very first bunch of slides that I have deal with the areas in question, so I want to get down to that kind of quickly. Of course, if this Norton thing didn't play, I'd probably be able to do it. All right. About once a week, this is where I wanted to show you. About once a week, a New York City infant dies of sleep-related death. All right. One of the first things that we found out in our research is that it's not in every neighborhood. All right. This here is a graph, is a Google map that shows clusters of where these deaths occurred between 2005 and 2012. And if you can see that this is Far Rockaway, this is Queens, this is Central Brooklyn, this is Northern Manhattan and the Bronx up in here, a little bit of Staten Island. You can see that the clustered areas are in the lowest income areas. We color-coded the zip codes in this map so that the dark red colors or the orangey colors are the low-income areas by zip code. Median household income, not personal income, the whole house. And what we found was that in the majority of cases, the family involved was living well below the federal poverty guidelines. I mean, federal poverty guidelines, my dog couldn't live under, never mind people that are 20 to 30% below those guidelines. So when people say to me, well, why don't people just put their kids in a crib and leave it up to that? I say to them, because people, A, don't have the money. If they had the money, they're trying to meet their, feed their kids, keep their lights on, you know, keep from being evicted, maintain their housing and whatnot. And secondly, they may not be the only people living in the apartment, so that they may have a very limited space. They're not going to have the room to set up a big crib like you see in Target and Toys R Us and all this other stuff. And so many times they make the decision to place the baby in the adult bed with them to sleep, feeling that they can keep the baby safe under those conditions, or they may not even know that that's not safe. All right. I also feel that this information is not getting out to the areas where it needs to go, which is why you have all these empty spaces of higher income areas where these deaths are not happening. All right, so I figured out Central Harlem, East Harlem, Washington Heights, you know, how many deaths they had, the Bronx, the Queens, and so on for that same period of time. But here I want to talk to you about Brooklyn, okay? In Brooklyn, East New York and New Lots between 2005 and 2012 had 20 of these infant deaths. 20. Just in zip code 11207 and 08. Just those two zip codes. 20 deaths in 7 years. Do you guys know about that? No.
No.
Now you do. All right, Brownsville had 11. A section of Bed-Stuy, because Bed-Stuy is Bed-Stuy depending on who's deciding what Bed-Stuy is. So the one zip code that I got for Bed-Stuy that is actually called that is 11233. That had 7 deaths, 1 a year. 1 a year, right? And in Canarsie, the Flatlands, we also had 7 more deaths. So what it really comes down to is that for Brooklyn, of these, just from these few zip codes, right, 45 deaths. 45 infant deaths that I am sure none of you people knew anything about. All right. Now, why don't we know about this? Because when it happens, first of all, it doesn't make the news. Somebody throws their kid out the window, that makes news, okay? Somebody shoots them up with a shotgun, that makes the news. But if a baby dies in a home and a crime is not committed, okay, it doesn't make the news. And for the most part, really, it's not something people talk about. People don't want to talk about that. They feel like it'll bring bad luck. They feel like it's harmful and hurtful to the people involved to talk about it, and it's just not a subject. When I tell people what I do for a living, they don't hang around me too long. Trust me, you know, because infant death is not something people want to talk about. The only people who want to talk to me are people who live through it, you know, because they find that they can't talk to anybody else about it. All right, so 45 sleep-related deaths in these few zip codes. And what are the disparities? Median household income. Most of these deaths occurred in an adult bed. Whether or not a person was sleeping with them is another story. About half the time somebody was, about half the time somebody wasn't. The reason these kids are in the adult bed, I am sure, is for a number of reasons. Heat, right? If the heat's not on, or you can't get the heat high enough in the wintertime, which is when we have the highest number of these deaths, then the parents are going to bring the baby into the bed to try to keep the baby warm. I remember a couple who did that one night last winter and lost their 4-month-old. You know, it's a nightmare. It's a horror. Whereas the health department's normal way of looking at, or its database of looking at how do parents put their babies to sleep, have the vast majority of them putting them in a crib or a bassinet. So I started to look at, well, who are they measuring? They're not measuring this area. They're measuring an average New York City population of about 181 persons for their data. Me, I have 363 dead babies who, with the investigations that happened, and the results of the autopsies, we know what happened, and we know why it happened, and we know how it can be prevented. The income disparity just shows that again, what I said about poverty. Most of these infants were fed formula before they went to sleep. Including infants that were breastfed during the day. Now, I know why that happened. It's because parents are desperate to get the baby to sleep through the night so they can get some sleep. All right? Parents are not made aware that infants aren't supposed to sleep through the night until they're about 6 months old. And besides that, even if they are aware of that, by the time a few weeks have gone by with a new infant, they're desperate to sleep. I remember it vividly. Making phone calls like, when are they going to sleep through the night? My God. You know, and thinking that I was going to die. So parents will feed the baby formula for the last meal to help the baby sleep longer so they can catch a few more hours of sleep. Those were the breastfeeding parents. Those who, 84% of these babies were fed formula before as their last meal. All right. So, needless to say, I'm on the breastfeeding bandwagon, you know, not just for the purpose of going along with the recommendations, but because this revelation tells me that infants need to be breastfed, at least at that age. Maybe later, when they're over 6 months old, and that's past the breastfeeding recommendation anyway, formula is not going to present an issue, but it does at this age. And where and how they died? Adult bed was 60%. 12% actually died in a safe sleep environment, okay? Those babies probably had a medical cause or what they call undetermined, or it was actually outright SIDS, okay? The rest died in car seats, on a couch or a futon, or in a variety of other places, strollers, all kinds of different things that parents will let a baby sleep in if the baby's already asleep and you don't want to wake them up, if you don't have the room to put a baby properly to sleep in a safe sleep environment. And what we found was that once a baby is able, at 85 days, to start lifting up its head by itself, I don't know if you can see this too clearly, but the number of deaths peaks at 84, and at 85 drops again. Meaning that if the baby is premature, low birth weight, or has some other issue going on with it, that maybe it spent time in the NICU or what have you, you can move that to the right a little bit. Maybe it's 85, maybe it's 90 days, maybe it's a little longer. If it's a full-term baby and they start to pick up their heads by themselves on the 84th day, the risk of them dying a sleep-related death in an unsafe environment plummets. So, you want to know about removals? ACS investigates every one of these deaths. The cops, the first thing the cops do when they arrive at the scene is to call the state registry. And what they're looking for is two things. Has this family been reported to the state registry before? Are they currently under ACS auspices or whatever? But it doesn't matter, because in any event, ACS is notified of the death and opens up a case. This is before any investigation takes place. They investigate, and what I was able to find out was that in my sample population of 363 families, all right, 66% of those families had other children in the family. So this wasn't the first baby. This was the second, the third, sometimes the fourth baby. And what happened, you know, as parents, I don't know, I'm just going to say how I know it is. I have 5 brothers and sisters who raised like 15, you know, nieces and nephews that I have. I only have the one. But as you go along, you kind of think, well, you can take shortcuts, you know, and you think you know things, and you don't keep up on the literature and all of that. You don't ask the pediatrician because you already know, and what worked before is going to work now, and blah, 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 you know. And that's not how it happens, you know. So anyway, 66% of these families had other siblings, and 14% of those were removed.
I just have to say, 14% of those
Were removed.
were removed.
Okay. Now, I don't know the reasons, and I'm not here to discuss that, okay? But I'm here to tell you that yes, when ACS comes, they will investigate, and if they think a removal's in order, that's what they're going to do.
See dollar bills.
So, the other things that I found out, of course, were some of the issues with the parents, that well over a third of them smoked. We didn't know if there were other people in the house that smoked too, but I would assume so. If you're living with other adults in the house and you're the only one smoking, they're going to have you out. But if everybody's smoking, then the poor non-smoker sits there with asthma and every other damn thing, you know. But anyway, 33% of these parents smoked. So I have literature over here. I just need the big, this here, which I hope you'll take with you. I have this in Spanish and English. This is not a Russian orphanage picture. This is a safe sleep environment, all right, for an infant less than 6 months old. If you look at the advertisements that Target and Kmart and some of the other larger retailers are starting to do, they're portraying the cribs that they're selling just like this. No bumpers, no blankets, no toys, no nothing in the crib, just a baby, a mattress, and a fitted sheet. All right. At 6 months old, they're not going to get up and ram their head into the headboard. All right? They're not going to do that at 1 month old either, or in a bassinet. The bumpers were taken out of cribs because something like 52 deaths were reported, that not just in New York City, nationwide, that were consistent with the use of bumpers in the crib. All right? So we advocate not to have bumpers in the crib. And now Babies R Us is telling us that they no longer put bumpers in that whole big package that they used to sell, you know, the comforter package and the whole nursery deal used to include the bumper. Now they sell the bumpers separately, Babies R Us is telling us. Okay, so there are one-piece sleepers called Halo Sleep Sacks. The guy that invented them lost his daughter at 4 months of age under a blanket back in 1992. His name is Bill Schmidt. Him and his wife invented this from the concept of a sleeping bag, punch the holes in the side and the neck, right, and have the zipper come up from the bottom so you can change the baby without having to take everything off. And they make them for every season of the year. And they retail for about $20, $21. But again, if you're living on, 30% below federal poverty guidelines, $21 is a lot of money. So if people are giving you blankets, you'll take them. And that's what happens. People get things as gifts, or it gets passed on down to them, or however they get them, and they use them because that's what they have. Okay. So we say share the room, not the bed. These are pictures of dads sleeping with infants on futons. I've counseled a couple of dads already whose babies have died that way. All right. We had an infant death just in this past quarter. That happened because the mom had the baby laying on her chest after she finished breastfeeding. Skin-to-skin contact is okay, but when you fall asleep and the baby falls asleep, the baby can and will suffocate if it's not able to move its head. All right. So these are investigation photos. These are pictures of real people who lost their children and are showing the investigator with a doll how that happened. This man is showing how he had the baby tucked in his arm and went to sleep with the baby like that, but pulled the baby close to him during the night and then rolled over on it. All right. This is an investigator portraying a mom who got ready to breastfeed. She falls asleep, the husband comes home, and she's flat out on top of the baby, which is why we don't advocate breastfeeding in bed. Or if you're going to breastfeed in bed, have somebody awake with you, you know? You're exhausted, you know, that's how I look at it. It doesn't matter which parent you are, or grandparent, or whoever it is. You're tired, and it's going to happen. You can't tell me that it's not. This is a similar situation. The mom fell asleep after breastfeeding, and the baby rolled between her and the couch. Okay. This was a baby that was left alone on a sofa and suffocated because it could turn over. This mom, what this mom did, and what many moms do, and dads, is they put a pillow or a blanket underneath the sheet or between the mattress and the baby to make it a softer environment. Because what's the chief aim in life of a new parent? To get some sleep and to get the baby to sleep. I train pediatric interns. I tell them, guess what the first question's going to be that the parent's going to ask you when they come for the well baby visit? So they go, oh, vaccinations, oh, wait. I said, no, they're going to want to know when the baby sleeps through the night. And how can they get that to happen? You know, so we're trying to get doctors and potential doctors to start looking through the eyes of the parents. Instead of giving this business, telling parents what to do, be more empathic with the situation that parents are experiencing and try to provide some assistance. This is the other thing that can happen when a baby is in a bed that's not a safe sleep environment. They can roll between the wall and the mattress, and they suffocate that way. Why doesn't the parent hear them? Because the baby's too young to cry out. These were parents that slept with a baby in between them in an effort to provide some measure of safety. The dad rolled back. This mom had a pillow environment. The baby rolled forward. This mom or dad had a blanket-lined bassinet, which the baby pulled over its face and suffocated under. And the beat goes on. Okay, so what we recommend for families that don't have the room and don't have the means is something like a pack and play. They are given out by some programs which place a lot of restrictions on who is eligible. So I'm trying to, through the development of a mobile application, develop a fundraising website that will be for cribs or pack and plays for whatever the parent needs to have a safe sleep environment. Since it's there's 125,000 live births in New York City every year. 125,000. That's more than the state of Michigan. The state of Michigan told me. Okay? So when you have that many thousands of babies being born, you know, and a certain percentage of them fall into the low-income brackets, the city turns around and the state turns around and says, how could we possibly fund, you know, or meet that need through taxpayer funds? Well, I'm not going to comment on that because I think a life is a life. And I think that when it came to car seats, we didn't have any problems figuring a way around that. And I think there can be a way to assess in the beginning of a woman's coming for prenatal care, does she have what she needs for the baby? You know, in terms of at least a sleep environment, if nothing else, you know, aside from all the other stuff, right, that folks need. And of course, to try and make sure that everybody involved with the care of the baby is on board with the safe sleep environment as well. That's all I have.
Thank you, Peggy.
Do you have any questions before I boogie on down to the J train? The L and the J. Do you have any questions? Yes.
Peggy, what made you interested in going into this particular field of practice?
It was an accident. I was told I could defend for my doctorate, which meant that I no longer had to do schoolwork, right? So my husband told me it was time to get a job, a real job. So I looked in the Times and they were advertising for a director of the SIDS program, and I told him, I said, nobody's gonna. And I was right. But once I got there and I saw the scope of what was happening and who it was happening to and why, it just made me outraged. I've been outraged for like 7 years and trying to get people to listen and understand that this is not people trying to tell you how to parent your child. This is about keeping the baby safe. And do I know about old child rearing practices? I'm the oldest of 6. They were all born in the 50s. Yes, I know all about that. But, you know, back then we didn't have car seats. We didn't have any of the, like the outlet things here. We didn't have anything. Toilet lid locks. I bought a basket full of stuff for my girlfriend's shower. Just the new safety items that keep kids from, you know, hurting themselves and so on. None of that was around when I was a kid. We didn't even have the safety caps. How many times kids drank ammonia and bleach and stuff like that? We didn't have it on medicines or anything like that. So what I say to people is, look, we would never roll the clock back to the 1950s in regards to child care. So what I'm trying to do is just bring you up to the 21st century in infant safety.
So Peggy, I don't have a question. It's more like, one, what can we do? That's one question, I'm sorry. And a statement is, it's a health issue, right?
It is a health issue. It's a safety issue. It's one that I think needs to be addressed when women present for their first prenatal care appointment. And it's not happening.
And then the other thing is, and I understand it's not about ACS, but I have to bring ACS into it, right? Because that's why we're here. That's what we do. We don't expect you to do that. So I think
that's okay,
right? Because I don't want you to do that.
Well, I know what happens, so right. You can ask me about it.
So okay, so we know because you just gave us the figures. You just said 66% of the children who might have had an infant death. Right?
Well, 66% of the families that had siblings, surviving siblings.
Right. And there was a
14% of those had a removal.
Had a removal.
Right.
So when I look at that, we're like 14% of those families, for me, right? It could have been avoided, is what I'm looking at. I'm looking at it could have been avoided because, one, we don't know. Once they knock on the door, irregardless to how they come to your door, there's a possibility of something.
Right.
So those kids were removed. But what we do know is that if there's a possibility for families to get information on safe sleep, get the cribs, get the appropriate, what did you call it again?
The nursery.
The nursery, right? So if they have the ability to do that, I'm thinking we want to prevent child fatalities and infant deaths.
Yes.
That's a quick way for us to begin to do that.
I think that the reason I'm here really is to help you understand that, I know I'm running out of time, that city agencies don't feel that they have the funding to do this, and they have other priorities. So I really feel it's up to the parents at this point.
And so I know we're running out of time, but I thought that was very important because Peggy and I have had a conversation about this, and I do believe that it's health and hospitals' responsibility to help families to get what they need. Again, it's a health issue. It's ACS responsibility to help families get what they need. And I'm saying all of this.
Well, ACS does distribute a crib to families that need one.
Okay.
They distribute that outright. So anybody that has an infant but doesn't have a crib, if they're an ACS case, they get a crib.
They also have a responsibility to fall in line
and
with everyone else, with the safe sleep, to make sure that families can get this information. There's absolutely
Every single family should have this information.
Right. So there's no postings in the community.
Now they do.
I don't know how many have seen one, because I haven't. If you've seen a posting about safe sleep, you seen it in your community?
No.
Okay.
But that's unbelievable.
Communities of color, who's seen it? You have seen it. Okay, and where do you live?
So I raised my children in Georgia, and the
Georgia
crib wasn't
does a
good
good
option
job
for me. I couldn't afford it, and like she said, the States, that was the first time I heard someone say that. And the pack and play is affordable
Pack and play.
But I've always wanted to be a doctor, so I knew about safe sleeping for my children.
Okay.
So it was your
I
personal
always did
investigation.
pack
Yes.
Right. And did you say Georgia or did you say New York?
Georgia.
Okay. I just wanted to be clear about that because I have not seen them at all. And I've asked parents if they've seen them. And I also, again, hospitals. We go to hospitals. So what we're saying is that we should be getting this information. We should be getting this information because surely this is an easy way. For me, I'm thinking that we want to save kids. This is an easy way to lower
the infant mortality rate in this area.
That's right.
Yes.
Will they put that in the maternity wards?
Well, that's where it belongs. But you know what? Even by the time somebody's delivered the baby, it's too late. They've already, you know, they're going to take that baby home into an environment that they already have if they're not alerted ahead of time. And when you, I don't know about you, but most women in labor and delivery afterwards tell me that they're like semi-drugged, they're flooded with a whole bunch of information, and you know, a lot of this stuff just goes by the wayside. Yes.
I know that he says they have like a after sleep, they would call it, campaign, and that was it about when you put this baby down to prevent this. But I'm not exactly sure as to how widespread it was as far as like what we're talking about. I know that they did something.
They did 2 symposiums where they invited, one year they invited all the not-for-profit agencies that have anything to do with infant care, and the next time, this past one that they had, they invited all the city agencies. But so far, what we have is preventive agencies and social work agencies trying to help out, but they don't have funding, you know, and it needs to come from elsewhere.
So I think, I'm sorry. I think, you know, also as like we have a lot of young moms, teenagers, and like they have their own private. Some of them have special clinics they go to because it's just teens. You know, they're underage, they're replace them with adults. But I know when I went with my niece, because she was pregnant, she's a young mom. But my other niece, who is an adult, that was never spoke about. And the ages of the parents are not, these are not teenage parents of these babies, because they are getting the information. The ages of these parents is roughly 21 to 28 years old, the biggest bunch, and they're not getting the info.
So, I'm sorry, so I wanted to say, unfortunately, we have to move on with the rest of the panel. But
if you want me to talk at anything at all, in this area or anywhere in Brooklyn, I don't care what the environment is. I'll come talk. All right.
So can we please thank Peggy for all? Thank you, Peggy.
Thank you for having me.
And also, again, pick up the leaflets that are there, the brochures that are left. There's contact information there. You can pick it up and you'll have that information. So let me just give Peggy 1 minute so that she can
let me get myself out. And you know what? I'll leave some business cards as well.
So we're going to move on to the next panelist, and that's going to be Angel McMillan. And Miss McMillan, anytime you're ready right now. You're fine.
So let me get my stuff out of here.
Yeah. But you're ready.
There we go. Okay.
Okay, so before I introduce Miss McMillan, she's going to ask me a question, so please bear with us for 1 minute. So Angel McMillan is a child welfare organizing project parent and has been actively involved in the organization for some time. She's been a parent affected by the child welfare system. She will discuss her experience dealing with the child welfare system. Thank you.
Hello everybody, my name is Angel McMillan again. For one, this is my first time as a parent telling my story. I would like to say thank you for all of us coming together in the community as parents affected my experience. My name is Angel McMillan, and I am a Black African American woman. I grew up with my 3 older sisters and brother. At the age of 17, I became a single parent. By the time I turned 20 years old, I gave birth to 4 children, 2 boys and 2 girls. During this time, I lived with my widowed father. We lived in a 2-story, 4-bedroom house, which my father owned in Robeson County, North Carolina. ACS entered into my family's life in 2004. As the main support in my life, my father gained custody of my first son. In 2005, I gave birth to a set of twins, a girl and a boy. Because of their father's criminal background and issues with drug addiction, ACS recommended that I take parenting classes. Suffering from a medical condition, ACS needed to know that I had the proper support in place for my children, in case anything was to happen to me. In 2006, I gave birth to another baby girl. A family friend stepped up to be the secondary caregiver for my family. With the support of my father and the extended family member, my kids and I were able to stay together despite struggling with the medical and mental health issues. In 2008, I resided in the state of Georgia with 2 of my children. ACS popped up again and entered into my family's life. This time, I was threatened. ACS recommended that I voluntarily put my children into kinship care or have the children removed and placed into different foster homes. In 2009, ACS removed my 6-year-old son and 3-year-old daughter from my care. I was mandated to family court and told to take parenting classes again and have substance and a psychological evaluation. While my children were in ACS care, they were both diagnosed with ADHD and put on medication. I graduated from the parenting classes in 2010. For 6 months, I participated in an Alcohol Anonymous support groups. Still suffering from medical issues, I voluntarily did the NAMI training. I also graduated from the program. At the age of 27, I gave birth to my 5th child. My son was born with a heart murmur as well as some issues with his breathing. Because of his medical condition, ACS summoned me to family court. The judge suggested that I apply to and complete CPR and parenting classes in order to be a better support to my child's needs. During this time, I resided in a family shelter, waiting to bring my newborn home. With the approval of family courts, ACS took custody of my son while he was in the hospital. In 2014, I lived in another family shelter. The case planner has refused to give me any information after she did the inspection of my living quarters. After 3 years, my children and out of home care are now up for adoption. All 3 of them are placed in different homes. ACS has mentioned to terminate my parental rights. I also continue to fight to regain custody of my children. I also continue to fight for them to be removed from the abusive homes they are currently living in, and for them to be allowed sibling visits. Thank you.
Thank you.
Does anybody have any questions, concerns? I'm free to open.
So if there's no questions now, Angel is still going to be here and be available to answer any questions that you might have. So thank you, Angel, very much.
You're welcome. Thank you for listening.
Continue to fight, Angel. Continue to fight.
Miss Denise here from NAMI of New York City Metro Health. In 2005, 2 weeks after her daughter Lucy was diagnosed with bipolar disorder, a single mom at the time, Denise decided to educate herself about her daughter's condition, particularly since she was finding that the existence of mental illness was often denied in her Caribbean culture. Inspired by what she learned, and soon went back to school to obtain her associate's degree in child psychology while volunteering at NAMI. After demonstrating strong leadership skills and passion for helping others in 2009, Denise, alongside 3 other parents from NAMI, New York City Metro, became basic teachers. Her commitment to the program led to her hire in January 2010 as a NAMI New York City Metro's Family Basic Coordinator and State Trainer. Denise is now the Program Director and taught over 200 classes, from which one I am a graduate, and 1,500 parents and professionals. Denise has been instrumental in NAMI New York City Metro's use of NAMI Basics to train workers in the child welfare and foster care system. She is also a parent advocate in the mental health system. So thank you, and let's welcome Denise.
Thank you all for having me. Again, my name is Denise, and I am the Program Director for NAMI New York City Metro. I just wanted to congratulate Angel. She was also one of my students in my class. I've had the privilege to work with her, and she's fighting very hard, and I hope she keeps on fighting. Don't give up. Don't give up, right? But NAMI is the National Alliance on Mental Illness, and it's a non-profit grassroots organization which has been around for like over 30 years. And the way NAMI started, it started with a group of parents just like myself, just like you all, sitting around a dining room table trying to figure out services and support for themselves and their loved ones. That's how NAMI started. To this day, we have NAMI in the 50th state. We have NAMI in the District of Columbia. We have Mexico, Puerto Rico, Canada, and I think we're trying to get, we have in Mexico, I think we're trying to get one in, what is this other location? Trinidad, the other Caribbean country. I'm hoping to get one in Belize. I'm from Belize, so I'm keeping my fingers crossed that one day we're gonna have a NAMI in Belize, but let's hope. So I came across NAMI in 2005 when my daughter Lucy was diagnosed with bipolar disorder. I'm not going to go into all her story, but she was a child that the school system didn't really know what to do with her, how to deal with. I was a single mom at the time, and I had 3 jobs. Unfortunately, I had to lose all of my jobs because the school didn't know what to do with her, how to deal with her. I used to get phone calls from my work. You got to come pick this child up. We don't know what to do with her. I used to live in Far Rockaway, for those of you that are familiar, and I used to work in Riverdale. So by the time I would get from Riverdale to Far Rockaway to pick my child up, 4 days out of the week, I know she would be sitting on the stairs because they would put her out. It doesn't matter if it was summer, winter, spring, I know I would find my child sitting outside. And so the teacher came to me one day and said, you know, I'm not sure what's going on with this child, but I think it's something going on in the household, so we need to figure out what's going on. I'm like, well, it's just me and this child. If there's something going on, I need to know as well. The teacher said, you know what? She said, you need to send her to the school social worker. They sent her to the school social worker. I remember very vividly, the school social worker took her inside the office, brought her out in like 5-10 minutes and said, your child has ADHD, take her home, find a therapist, find a psychiatrist for her. At the time, I didn't know what was going on with this child. All it's going to be over. But we've gotten to a part, or I've gotten to a part where I could lift somebody up that's down there and help them run that race along with me. And that's my mission to do from now on.
Thank you. So we're going to move on to Joyce Millman. I got it right that time, Ms. Millman. Again, the activist, I've said it over and over again, and she's been doing this a long time, and she's going to give us some of her very, I would say, experience in this work that she's been doing since the early 1990s. And so whenever you're ready, ma'am.
Well, hello everybody.
Hello.
The story is the same. It hasn't changed wherever you go, whoever you get in to talk to. This is the, well, I won't take it off of there. Time magazine wrote this article regarding our beloved foster care system. The shame of foster care. The coroner gave up counting injuries inflicted on 6-year-old Terrell Peterson.
Ms. Nevin, I'm sorry, tell us the year of that article.
2000. November 13, 2000. And it's a system that needs who they have to get where they're going. It's like a car. I need a car to go to Jersey. And these children who are in this system are pawns. I'm a victim. I had 2 nieces in the system. And I stepped forward to step up as a member of the family who would substitute for their mother, who was my niece. In actuality, they were my grandnieces. And in doing so and not knowing anything about the system, or knowing anybody who had been in the system, I stepped up to become the guardian for them as far as bringing them out into my home and finishing to raise them till their mother could get herself together. And I went to Senator Patterson at that time, and he wrote a letter to the judge asking her if she would consider letting them come to live with a family member. And I went to court, made the court date, went to court, and knowing nothing about the system, knowing of it, but nothing about it, and thinking, oh, well, I'll go in, I'm their aunt, and, you know, they'll see me and just let me get involved and get, I'll be their guardian until their mother, which was my niece, would get herself together, and we'd go on down the yellow brick road. So I go to court, I get the court date, and I go, and the social worker for the my nieces stood up and introduced me to the judge, saying that I was the aunt, and I was there to see if I could take responsibility, be given responsibility for them. I was asked to stand up, my first time in court in my life, so I don't know the procedure. So I stood up, and she spoke to me for a few minutes, but she studied writing. And I have the order here. She's not to go near them for 1 year. No visiting, no nothing. I don't know anything about this system because I was never involved, and it was like, I came to get visiting, what's going on, to myself. And she wrote up the paper, I have it here, but I popped out her court order, so and so and so. The guy that stands by the podium that gives out whatever, she came over and gave me the paper. Next. I got up, I got to the elevator, I got on it, I got to my car that was 2 blocks away, and when I got in it, I became hysterical. I had no one with me, no one to, it's all right. And that lasted for half an hour. Went home and cried. That was around 3 o'clock. My kids came in, 2 daughters came in at 7. And my face was swollen, you know, from the crying. And they walked, what happened? Oh. And I told them, and I said, I'm letting you know tonight, I'm your mother, and you have the right to know. I'm going into these woods, and I don't know if I'll come out alive. But there's one thing that I do know. I got to go in. This is America. How can you tell me as a stranger not to go near my flesh and blood for 1 year? And of course my kids were against it. Ma, you know nobody, you don't know nothing, you've never been in this, you did. I said, I can learn. I know a God that will help you to learn. And I went forth into the madness. And it is a madness that is toppled, sugar-coated, with the cherry on top for the money that our children generate, just like they did in time of slavery. But this is called modern day. And I began to fight. And I went everywhere. I got a calendar that everywhere I went to find out who could help me, I would put it on that calendar. Every day, every place, everywhere. Until I got to the office of the city, the speaker. What's that position?
Public advocate?
Public advocate. I got to that office and told my story, you know, whatever. And the lady looked at me and she said, Miss Millman, there is absolutely nowhere you can go. In the city of New York, there is no place that you can go and sit down and tell your story to. You are the first kid on the block. And I got up and I left, got in my car and went home. And I knew the call. You can hear when God calls you. You know his voice. And from that night on, I fought. I fought. And a year later, they walked out of the court on 161st Street courthouse in the Bronx of New York City. They were freed. And today they are married with children. One went to college, got good jobs. They know who their family is. And that's because I fought the battle that I fought. In my fighting, I ran across someone, I'll read this and I'll be finished, who happened to be the psychologist. They have a psychologist in the family court who interviews the parent or whoever's in charge of the child to find out if the parent or the relative is capable of having the children or getting the children out of the system. And in that, I'll read this and I'll be finished, because it tells the rest of the story. In finding this particular person from the inside of what goes on behind the closed door. And he writes, I am a psychologist, a writer, and an editor of the Journal of Mind and Behavior. I'm the core director with Dr. Marnie Weinstein, the Family Therapy Institute of New York City, and executive director of Network Against Coercive Psychiatry, the author of Madness. Hearsay and the Rumor of Angels, and a public speaker who has appeared on numerous shows, including William Buckley, Fire and Line, and Oprah Winfrey. I believe that Joyce Millman, as founder and director of UWCC, is performing an invaluable service by providing families in the inner city with guidance and resources to help them preserve their families in the face not only of poverty, but an orchestrated effort on the part of the child welfare system, fueled by economic and political motives to dismember families and place children in foster care system. As a dissident psychologist and a critic of the practice of my fellow professionals, I am personally encouraged and reassured whenever I find individuals who are willing to take an unpopular position for the sake of a greater principle. For Joyce Millman, this decision was an act of courage. She was confronted with personal misfortune in 1988, the 2 young children of her nieces who were taken into custody by the Child Welfare Administrator. Mrs. Millman rallied to her niece's support. Not only did she resolve to obtain justice for her family, but she had the wisdom to view her own situation within the larger political context of the exploitation of the poor by the child welfare system. And she had compassion of the exploitation of the poor by the child welfare system. And she had compassion and fortitude to affirm her solidarity with other victims of the welfare state. Thus, she founded UWCC. Survival and revitalization of American democracy depends on the existence of individuals like Ms. Millman, who are willing in a time of crisis to seize leadership and to stand up on behalf of those who have been excluded from the American dream, those whose tragic plight demonstrate that the ideal of equality and justice for all is still to be realized in America. And that is how I started it. I've been at it, but I gave it up and had to rest, had to take a leave because I got so embedded, so down in the deep of it. So I took off, and the Spirit came and said, it's time to go back. I'm laying in bed, minding my business, contented as ever. And I said, go back? And I said, oh. So now I am back and forth, you know, I'm on the door, yes, Lord, yeah. My daughter goes up to, where's that place you all went to?
The caucus.
Huh?
To the caucus.
No.
The Black Caucus.
In
Albany.
Albany.
Mm-hmm.
Mom going up to Albany and so forth. She's in construction, so they're having this and that. And she calls me, Mom, I found this lady, and so and such a thing. And she's at the foster care, and this and that. And I said, wait a minute, Mona, hold it now. And so, Mommy, and this, and I told her to call you, and this and this, and I said, yeah, well, that's good. Let me talk to her and see what's what, because I think the bell is ringing. He wants me back on the battlefield. Let's see what's going on here. And she came home, and she just was excited that she met this Dory. And I went to see her, and you know, we talked and everything, and that's how I'm here today, because she said we were going to have this meeting over here, and we do this, and so when you're going to re-enter a situation, you got to jump on the bandwagon. Because see, when I was out there before, I was alone. I knew nobody, I knew nothing. All I knew is I had to fight. But see, I tricked them, because she said don't go near them for a year. But I found them through the school system, giving their name to different schools, and I hit the number. Yes, there's students here, and I went exactly where they were, sat in my car like I had robbed the bank, and waiting for them to come out with the bag of money, and I called them, looked around, cause I saw them come, and Serena, Tessa, huh? So I said, come here, come. They came over. Oh, Joy, oh, it's you. Like, what, how did you, where did you come from, you know? I said, be quiet, because I'm this and that, and I want you to do this and that, and we'll come in, we're going to fight for you. Don't you do anything bad. Don't do no kind of situation. And a year later, the paper was put in my hand. They were released. to my custody. Now look at what the agency did. Released them, everything is good by the law. 2 days later, 2 plainclothes men in street clothes, ring my bell. And I go to the door, "Are you Joyce Millman?" I say, "Yes, I am." Got his badge, flip. "I'm Detective so-and-so and so, and I'm here to about Zarina and Tessa and so forth and so on." I said, "Oh yeah, they were released. I got the paper, you know, the letter and everything, and give me a moment, I'll run up and get it." So I ran upstairs and I got the paper and I gave it to him. He was inside the office, and one of them got on the phone and called the worker. He said, "Don't you know if we had handcuffed her and took her out of here, that she could sue us up to you know where? How could you do this? How could you send me here to about the children if they were already released and she has the paper?" But that's how deep, that's how far they will go, and that's what it is, because it's all about money. Every child brings $1, like they did in the days of slavery.
Ms. Millman, thank
Yes.
you. Thank you so very much.
And thank everybody. I'll up my supplies soon.
Well, let me say that we need more boots to the ground.
Yeah.
That's why we're here. Child Welfare Organizing Project and Fostering Progressive Advocacy is because we do need more boots to the ground, because as you stated, the business is not finished. It's just not finished. Yes, ma'am.
Can I just say this?
Yes,
again?
ma'am.
Is that for me, as someone started out before and there was no one or no place to go, this is like a fairyland.
Yes.
To see all these people sitting here and this one did this and that. It's like God, I went away from it. But because I was away, He prepared a place for me to come back to. Because you're not finished yet.
Not finished yet.
And you got to finish with God.
So I want to say thank you again to all the panelists and to everyone that has come out here tonight. We do have literature. We want you to pick up some literature and take that with you. We also have, I would be remiss if I just say we're going to leave here just like nothing happened, because something did happen tonight, and we have a call to action for every single person in this room. We're saying contacting your government officials. We have a document here on the table. It gives every single list of who you need to contact about the child welfare system. So we're saying not only contact your city government, we want you to also stay in contact with Child Welfare Organizing Project and Fostering Progressive Advocacy, because we are continuing the town hall meetings throughout the city of New York. Our next town hall meeting will be in Manhattan. And I am going to call on Celestine, I think she just said to me, March 17th. And the location will be?
1771 and 3rd Avenue.
1771 3rd Avenue at East 98th Street, Union Settlement. We will be putting out information concerning that. We will have other locations on it as well in Manhattan. We are saying to you that this is a subject and a topic, and Ms. Millman said it. She said when she was out here many years ago, the late 80s, early 80s, that she was actually the only person out here. And I will say to you that I absolutely believe that. That is why we have decided that the system will not move unless we, as a people, affected, not affected, youth, kinship, because that's what you are, right? They didn't name you back then. We just know we raise our kids, right? So now there's a name for it. It's called kinship foster care. But it is for that reason that we're calling on every single person to get involved to transform the system. We must do this. It is absolutely necessary, and there is no excuses. We must do it. We must keep our children together. We must keep our children safe. We must allow our communities to nurture them and bring them up in a safe environment, because we've done it before and we can continue to do it, but we cannot do it alone. So please come out. This is a call to action to do something. Don't let this literature go to waste. Please pick it up, share it, take it with you, spread the word, invite more people to come out to the town hall meetings that we'll be holding. Thank you so very much, and yes, ma'am.
What about bringing some of the meetings into Manhattan? If we can get that done.
That's what we're doing.
Oh, you are?
Yes, we're going to repeat it again. We have our first date in Manhattan, March the 17th, 1772, 1771, 1771, 3rd Avenue. No, I'll give it to you again. Don't worry about it. I'll give it to you again.
You're going pretty fast there.
1771, 3rd Avenue.
What street?
That's at East 98th Street. And that's on March 17th from 6 to 8 p.m. Okay, so we got surveys coming around. We have literature left. And also, I would like to again say thank you to the panelists. I can't say thank you enough because this is important work here and you're sharing your life and your stories. And this is just a token of our appreciation for coming out and being here tonight. And I'll say again to the audience, our panelist is still here, so if you'd like to have a chat with them, please do have a chat with them as